Good day! I am EAPascual from the Department of Education, Laguna.
And I am UAAlias from Balian Community College, Laguna, Philippines. The title of our study is Analysis of Antibody Development against COVID-19 among persons who had experienced flu-like symptoms in Pagsanjan, Laguna, Philippines.
The world was startled by a disease-causing virus that could lead to death due to unknown treatment. This was believed to have started in Wuhan, China, and was rapidly found to be a novel coronavirus in December 2019. Several types of research were done to find out the characteristics of the said disease. It was believed that this disease had the same symptoms as the flu. These symptoms appear 2 to 14 days after infection with the virus, which includes fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. While the symptoms of loss of taste and smell are rarely found in persons who have the flu.
Many patients with flu-like symptoms have not yet been tested for SARS-CoV-2. Since one of the researchers, no laboratory procedures, the researchers came up with the idea of using a rapid antibody test as a tool to detect the possibility of the patients having infected with COVID-19 disease. As well, researchers believe that performing rapid antibody testing before vaccination against COVID-19 would be a great help before getting a job against COVID-19.
According to Black and others of 2021, lateral flow immunoassay or rapid antibody test is a qualitative test used in determining the presence of immunoglobulin G and immunoglobulin M. It is also used in the detection of antibodies to SARS-CoV-2. The samples used for this diagnostic tool can be plasma, serum, or whole blood. The use of this rapid antibody test would allow for greater knowledge and understanding of antibody development and its impact on the general population. Also, data from this research would benefit healthcare providers, patients, and local governments. Furthermore, it could be a tool to analyze the presence of antibodies before COVID-19 immunization or vaccination.
A suggestion to a study that SARS-CoV-2 viral-specific antibody response profiles are distinct in different age groups, according to Young in 2021. Also, a study from COFEL of 2022 suggests that men tend to have a higher risk of severe infection and mortality related to COVID-19. It is believed that elevated estrogen levels in female COVID-19 patients may reduce the severity and mortality of COVID-19 deaths through an elevation in the innate and humoral response. In terms of occupation, our research states that there were no significant association on antibody testing among persons who had tested positive on SARS-CoV-2 antibodies according to Acuron in 2021.
Clonal selection theory plays a major role in the study made by Yadav and others of 2021. It shows the process of developing antibodies once the antigen has entered the body. Seroconversion, also known as antibody development, is the process by which a patient accumulates antigenic specific antibodies against an epitope. It is the first step towards the development of adaptive immunity against pathogens. While this is not a guarantee of protection against future infections, positive seroconversion is an informative measure of past viral inactivity in the population.
What is the demographic profile of the respondents? What is or the flu-like symptoms experienced by the respondents? What is the COVID-19 vaccination status of the respondents who had experienced flu-like symptoms? What is or are the types of antibodies developed among persons who had experienced flu-like symptoms? Does the developing antibodies among persons who had experienced flu-like symptoms significantly depend on their demographic profile? Does developing antibodies among persons who have had experienced flu-like symptoms significantly depend on the vaccination status?
The subjects of the study were 50 persons from different age groups, genders, occupations, and COVID-19 vaccination status. The number of respondents was based on the number of respondents who voluntarily participated in the study.
The researchers decided to conduct a quantitative study to approach subjects of the possibility of COVID-19 antibody development among persons who had experienced flu-like symptoms. The quantitative research performed survey and antibody tests to 50 respondents who participated to the study. The respondents were composed of male and female from different age groups, occupation, and vaccination who had experienced flu-like symptoms. This is the chi-square test result of developed antibodies across occupation group. The student group is unlikely to develop IgM antibody. The unemployed group is unlikely to develop IgG and IgM antibodies at the same time. On the other hand, the employed group is unlikely to develop IgM antibody, and both IgG and IgM antibodies being negative at the same time. This known fact for the sample respondents in this study is established by the chi-square value being higher than the critical value, signifying that the development of antibodies significantly depends on the occupation of the person. This is supported by the p-value 0.00997, which is lower than the alpha value 0.05. With 95% level of confidence, there is enough evidence to claim that the development of antibodies significantly depends on the occupation of the person.
The table shows the chi-square test result of developed antibodies across vaccination status group. The partially vaccinated group is unlikely to develop IgM antibody, unlikely to be both positive IgG and IgM antibodies at the same time, and also unlikely to be both negative in IgG and IgM antibodies at the same time. The fully vaccinated group is unlikely to develop IgM antibody and also unlikely to be both negative in IgG and IgM antibodies at the same time. On the other hand, the unvaccinated group is unlikely to develop IgM antibody and also unlikely to be positive in IgG and IgM antibodies at the same time. This is known fact for the sample respondents in this study is established by the chi-square value, signifying that the development of antibodies significantly depends on the vaccination status of the person.
The COVID-19 disease had a tremendous impact on healthcare society not only in the Philippines and also globally. The spread of COVID-19 disease is still indistinct due to unreported and undocumented cases. The findings of this research are that majority of the respondents in all age groups are likely to develop IgG antibodies. Among age, gender, occupation, and vaccination status, the development of antibodies is significantly dependent only on occupation and vaccination status. With a 95% level of confidence, there is enough evidence to claim that the development of antibodies significantly depends on the occupation and vaccination status of the person.
To the medical institution and healthcare workers, the researchers suggest that people undergo antibody tests before getting COVID-19 jobs for the reason that there are several cases where those who experienced flu-like symptoms had developed antibodies against COVID-19. This means that the flu-like symptoms experienced by a person might be a COVID-19 disease. Also, quantitative and qualitative antibody tests could assist health workers in guiding rational vaccine choices. Furthermore, the COVID-19 antibody test may help to determine the length of immunity in a person's body after experiencing symptoms.
It is recommended for local government units to enhance the safety measures to prevent widespread of COVID-19 disease. Also, antibody tests could also help identify COVID-19 cases were not documented due to various reasons. It is also a path to further assess if there is possible local transmission in a community, so they may enhance safety measures in their respective areas.
Once again, I am EAPascual from the Department of Education, Nagcarlan, Laguna.
And I am UAAlias from Balian Community College, Pangil, Laguna, Philippines. Thanks for watching. God bless and have a great day.